Hello, my name is Xavier Lopez, and I'll be performing a physical assessment for NR 509.
My name is Abby Higgins. I give permission for this examination and submission to Chamberlain College of Nursing for grading.
All right, so now I'm going to be doing a 360 view of the room. I will start by inspecting her face for any skin lesions or discoloration. I note that her head is midline and symmetrical. I will start by, next I'll be moving on to inspecting her lymph nodes. I'll start by palpating the preauricular lymph node in front of the ear, postauricular lymph node behind the ear, occipital lymph node right behind the head, and then the tonsillar lymph node, and then making my way underneath the jawline to the submandibular lymph node, the submental, and then making my way over to the anterior cervical lymph node, the posterior cervical lymph node, and then making my way forward over to the supraclavicular lymph nodes above the clavicles. Next, I'll be testing cranial nerve number 5, which is the trigeminal nerve. It has a motor component to it, so I'm going to tell Abby to go ahead and clench her jaw, and I'm going to feel over the masseter muscle, and I notice she has great strength without any distortions. It also has a sensory portion to it, so go ahead and close your eyes. I'm going to tell Abby to tell me where she feels my touch on her face.
Right cheek, left cheek, chin, nose.
Sensory appears to be intact. Next, we're going to be moving on to cranial nerve number 7, which is going to be the facial nerve. So I'm going to tell her to make a series of different facial expressions. So go ahead and smile. Her smile is even and symmetrical. Go ahead and frown for me. That is also even and symmetrical. Go ahead and raise your eyebrows. That is even and symmetrical. Go ahead and poof out your cheeks. That is even and symmetrical. And go ahead and squint your lips. Pucker your lips. Very good. Next, we're going to move over to her ears. I'm looking at her ears, and I notice that they're symmetrical. I'm looking for any skin lesions, nodules, or swelling, and I do not know any. Next, I'm going to be utilizing my ophthalmoscope. I'm going to utilize the light portion of my ophthalmoscope. I'm going to pull her ear up and back as I insert it into her external auditory canal. And as I insert it into the external auditory canal, I noted that it is clear. I do not know any redness, drainage, swelling, or cerumen, and I note that her tympanic membrane is pearly and gray. So I'm going to pull that out. Next, I'm going to be looking at her other ear, and once again, I'm going to be pulling up and back, and as I insert into her ear canal, external auditory canal, I notice that it's clear, and I do not know any redness, drainage, swelling, or cerumen, and I note that the tympanic membrane is pearly and gray. I'm going to pull that out, and there's no fluid in the middle ear. Next, I'm going to be feeling her pinna and her tragus. So I'm going to start with the pinna for any. I'm feeling for any nodules or tenderness. Do you feel any tenderness?
No.
Now I'm going to feel for the tragus that's located in front of the ear. Any tenderness?
No.
Very good. Next, we're going to move on to testing cranial nerve number 8, which is going to be the acoustic nerve. This is going to be utilized using the whisper test. So I'm going to tell Abby to go ahead and cover one of her ears, and I'm going to cover my mouth, and I'm going to whisper 3 words, and she's going to say them back to me.
1, 2, 3.
Okay, other side.
4, 5, 6.
Hearing is intact bilaterally. Next, we're going to move on to the eyes. So I note that I'm going to start by inspecting her conjunctiva. And as I pull down and look in, I note there's no drainage, swelling, skin lesions. And it appears to be pink and moist and clear. Next, we're looking at her sclera, and I notice that it is white and clear. Next, we're going to be testing cranial nerve number 2, which is going to be the optic nerve. It has 3 portions to it. First portion, we're going to be testing the visual acuity test, or central vision. So I'm going to be utilizing my Snellen eye pocket chart. I'm going to stand 6 feet away. I'm going to tell Abby to go ahead and cover one of her eyes, and she's going to read the lowest line possible.
LTFPH.
Now other eye.
LTFPH.
And now both eyes.
LTFPH.
Abby has 20/20 vision in her left eye, right eye, and bilaterally. Next, we're going to be testing the second portion of cranial nerve number 2, which is going to be the optic nerve. We're going to be testing peripheral vision. So I want you to go ahead and stand up, and you're going to let me know when you see my hands. So we're coming in from the middle.
I can see them.
Coming up from the top.
I can see them.
And coming up from the bottom.
I can see them.
Abby has intact peripheral vision. Next, we're going to be testing the third portion of cranial nerve number 2, which is the optic nerve. We're going to be testing the accommodation to light. So I just want you to go ahead and stare at my nose, and I'm going to come in from the side. I notice that the pupil constricts, coming in from the other eye. Once again, I notice the pupil constricts. Her eyes are 2 to 3 millimeters bilaterally in accommodation to light equally. Next, we're going to be moving on to testing cranial nerve number 3, which is going to be oculomotor, cranial nerve number 4, which is going to be the trochlear, and cranial nerve number 6, which is going to be the abducens. To test for this, we're going to utilize either a star pattern or H pattern, and today we're going to be utilizing the H pattern. So Abby, I just want your head to be midline and symmetrical, and I just want you to follow my finger without moving your head. All EOMs are equal bilaterally. Next, we're going to be moving on to the nose. I note that her nose is midline and symmetrical without any deviations or swelling. Next, we're going to be utilizing my light source. And I'm going to push up with my thumb as I insert my ophthalmoscope into her nose. So I'm going to push up with my nose, or with my thumb, and as I insert inside, I know I'm angling anterior medially toward the septum, and I notice that her septum is midline and symmetrical without any drainage, swelling, deviation, or fractures. I notice that her turbinates are pink and moist and clear. Okay, I'm going to go to the other side. Once again, I'm pushing up with my thumb as I insert my ophthalmoscope, and I'm angling it toward the septum. Septum is angled, is midline, symmetrical, without any fractures, swelling, or any bogginess or swelling. And I notice her turbinates are pink and clear. Take that out. Next, we're going to be moving on to feeling her maxillary and frontal sinuses for any tenderness. So let me know if you feel any tenderness.
No.
No?
No.
Okay. Very good. No tenderness noted in the sinuses. Next, we're going to be moving on to the lips and, or the mouth and throat. So I'm going to be inspecting your lips. Notice your lips are pink and moist and without any cracking or dryness. Next, I'm going to have Abby go ahead and open her mouth. And I'm utilizing my light source with my ophthalmoscope. As I look inside, I'm looking at her teeth, and I notice there's no decay or cracking. I'm looking at her buccal mucosa, and I notice it's pink and moist. And then I'm looking at her gums. I do not know any redness, swelling, or drainage. Next, I'm looking at her tongue. I notice it's smooth and clear and pink and moist without any cracking or dryness. Go ahead and lift up your tongue. I'm looking at the floor of her mouth. Notice that it's pink and moist without any drainage, swelling, or skin nodules. I'm going to put that down. Next, I'm looking at her buccal mucosa on both sides, and I notice it's also pink and moist. And then now I'm going to be looking at her soft and hard palate, and I notice that is also pink and moist. And then looking at her postnasal pharynx, I notice that's pink and moist without any redness, swelling, or any postnasal drainage. I notice she also has tonsils, and I would grade them a grade 3. Very good. Next, we're going to be moving on to testing cranial nerve number 9, which is going to be the glossopharyngeal. The test for that is going to be the testing the gag reflex, but we're not going to test for that today for purposes of this exam. And then next is going to be testing cranial nerve number 10, which is going to be the vagus. So to test for that, I would utilize my light source once again. And as I insert it into Abby's mouth, I'm looking at the uvula. I'm going to tell Abby, go ahead and say ah. And note that the uvula rises symmetrically to midline. Next, we're going to be testing cranial nerve number 12, which is going to be the hypoglossal. I'm going to tell Abby to go ahead and stick out her tongue, then move it side to side. Very good. Cranial nerve number 12 is intact. Next, we're going to be moving on to Abby's neck. I note that her neck is midline and symmetrical without any deviations or swelling. Next, I'm going to be feeling for the trachea. I'm going to palpate the trachea on both sides, and I notice that it is even and symmetrical without any deviations or swelling or deformities. Next, we're going to be palpating for the thyroid gland. So to do this, I'm going to put one hand and feel for the cricoid process, and then put my other hand and feel for the, put at the suprasternal notch. And then I'm going to utilize these two landmarks on either side. And I'm going to retract on one side and tell Abby to swallow. And I'm feeling for size and any nodules. And I do not feel any. And then I'm going to do the same to the opposite side. I'm going to retract and tell Abby to swallow. And I'm feeling for any size and any nodules. And I do not feel any. That would be the thyroid gland palpation. Next, we're going to be testing the next we'll be feeling for the carotid glands located on either side of the trachea. So we're feeling one at a time. So I'm going to feel good. And I'm going to feel very good. Her pulses are normal and bounding. Next, I'm going to be listening for any bruits. And to utilize this, I would tell Abby to hold her breath so lung sounds don't interfere with auscultation. And I would do this with the bell of my stethoscope. Go ahead, hold your breath. Very good, breathe. And go ahead and hold your breath. Very good, and breathe. Okay, next we're going to be assessing the range of motion of the neck. So Abby, go ahead and put your chin to your chest. Very good. Go ahead and look up at the ceiling. That would be extension. Now go ahead and look over to your left shoulder. That would be lateral rotation. Now look to your other shoulder. That would be rotation. And now put your ear to your shoulder. Very good. That's lateral flexion. And look to your other shoulder. That would be lateral flexion as well. Next, we're going to be testing cranial nerve number 11, which is the spinal accessory nerve. I'm just going to apply a little bit of pressure on her shoulders, and she's going to apply against resistance. She's going to shrug against resistance. Very good. The strengths are intact equally and bilaterally. Next, we're going to be moving on to the heart sounds, and I'm going to be utilizing my stethoscope. Okay, using the bell of my stethoscope and the diaphragm as the patient is sitting. So we're going to start off at the second intercostal, the aortic valve at the second intercostal space, right sternal border. Next, we're going to be moving on to the pulmonic valve located at the second intercostal space, left sternal border. Then we're going to be moving on to the third intercostal space, left sternal border, which is going to be the Erb's point. Then we're going to be moving on to the tricuspid valve located at the fourth intercostal space, left sternal border. Finally, we're going to be moving on to the mitral valve located at the fifth intercostal space, mid-clavicular line, left sternal border. Very good. Next, we're going to be moving on to listening to the lung sounds, anterior lung sounds. So I'll be starting off at the intercostal spaces. So Abby, I just want you to breathe normally. Very good. Lung sounds are clear bilaterally. Now, Abby, I just want you to go ahead and stand up and face away toward me. Yep, very good. And I'm going to be listening to all 8 lung fields, beginning above the scapulas. And once again, just breathe normally. I'll make sure to hit the left, right, middle lobe, right here. All right. Lung sounds are clear bilaterally. Next, we're going to be moving on to the deep tendon reflexes, cellular coordination with rapid alternating movements. So to utilize this, I'm going to have Abby go ahead and take her palms out, and she's going to take her thumb, she's going to hit her index finger, her middle finger, her forefinger, and the 5th finger on both sides, and do that rapidly. Very good. Her coordination appears to be intact. Next, we're going to test the second portion. So go ahead and take your palms and put them on your thigh, and then put them up towards the ceiling, just like that. Yep. And then do that rapidly. Very good. Her coordination appears to be intact. Next, we're going to be testing the deep tendon reflexes. And I'll be utilizing this using my hammer. So first, we're going to be testing the bicep tendon. So go ahead and let me see your tendon. I'm going to support her tendon. I'm going to put my thumb at the medial aspect of her antecubital fossa. And I'm going to use the pointed end of the hammer, and I'm going to strike my thumbnail. And as you can see, she had good reflexes at the bicep tendon. Next, we're going to be moving over to the patellar reflex. And I'm going to be hitting it with, or striking it with the flat end of the hammer. And the patellar reflex, or patella, is right here. And as you can see, she has good reflexes at the patellar tendon. Next, we're going to be going to our testing the Achilles reflex. So I'm just going to readjust the angle of the camera so you can see the Achilles tendon. Okay, and I'm just going to support her ankle just a little bit, and I'm going to have her perform a little bit of dorsiflexion, and I'm going to strike the back end of the Achilles tendon utilizing the flat end of the hammer. And as you can see, she had a little bit of pronation there with good reflexes to the Achilles tendon. Next, we're going to be moving on to the inspecting the upper extremities. So Abby, go ahead and take your hands out like this. Very good. I'm gonna just readjust this camera just a little bit. Okay. So go ahead and extend your hands out like this. I'm looking at her, the joints of her hands for any redness, swelling, deformities, or lesions. I do not know any. Next, I'm going to be testing for capillary refill. So I'm going to just apply a little bit of pressure on the nail beds of her finger until they turn white, and then I'm going to release. And I notice they turn a healthy pink. And I'm going to do the same to her other hand. Once again, I'm applying pressure to her nail bed until it turns white, and then as I release, it turns a healthy pink within less than 3 seconds. So she has good, healthy capillary refill. Next, we're going to be testing our, I'm going to be inspecting her radial pulses. So go ahead and place your hands inward just like this. Very good. And I'm going to be feeling her radial pulses. Very good. She has 2+ pulses bilaterally. Next, we're going to be testing grip strength. So go ahead and take my fingers and go ahead and squeeze very tight. Very good. Her hands are 5 out of 5 strength bilaterally. Next, we're going to be moving on to the range of motion of her elbow. So We're going to be doing flexion, extension, and then next we're testing the strength of her biceps and triceps. So just go like this. There you go. And go ahead, push against resistance. Very good. Push towards you. Very good. Her strength is 5 out of 5 bilaterally. Next, we're going to be moving on to the range of motion, passive range of motion of the shoulder. So this is going to be flexion, extension, and then adduction, abduction, internal rotation, external rotation. Range of motion appears to be intact at the shoulder, the elbow as well. Next, we're going to be moving over to the abdomen. So go ahead and go ahead, place yourself on the bed there. And I'm just going to readjust the angle to see, to get a good angle here. Readjusting the camera. Very good. Okay. All right, so we're moving on to the abdomen. I'm going to expose her abdomen. I'm going to expose it. All right. I'm inspecting her abdomen for any abnormal symmetry, deformities, or any kind of abnormal contours, and I do not see any. Next, I'm going to be auscultating her abdomen in all 4 quadrants. Bowel sounds appear to be present in all 4 quadrants. Next, we're going to be moving on to auscultating for any bruits. So we're going to start right below the xiphoid process, which is midline to the body. We're going to be auscultating the aorta. So just below the xiphoid process. And then we're going to move over to the left renal, which is above and lateral to the umbilicus. Now we're going to move over to the right renal, which is to the right and above the umbilicus. And then we're going to move over to the left iliac, which is below the umbilicus to the left. And then we're going to move over to the right iliac, which is going to be to the right and below the umbilicus. And there are no bruits indicated or heard. Next, we're going to be moving on to percussion. I'm going to be feeling for any tympany, dullness, or flatness. And it appears there are none indicated. Next, we're going to be, I'm going to feel for palpation. I'm going to be moving on to palpation in all 4 quadrants. I'm going to be feeling for any abnormal masses or tenderness. Any tenderness?
No.
Okay. Next, we're moving on to feeling for the liver and the spleen. So we're going to start with feeling the liver. So I'm going to put my left hand right below her back, and then you notice that the costal-vertebral angle is at the midclavicular line on the right side. I'm going to place my hand right below the costal-vertebral angle, and I'm going to tell Abby to go ahead and take a nice deep breath in, and then I'm going to press inward and upward, and I might be able to feel the edge of the liver. Okay. Next, we're going to be feeling for the spleen. So I want you to angle toward me laterally. Very good. I'm going to place my my right hand right behind her back. Once again, the costal-vertebral angle is right at the midline, and I'm just going to place it right below the costal-vertebral angle. And then I'm going to tell Abby to take a nice deep breath in and out. And then once again, I'm pressing inward and upward, feeling for the spleen, and I do not feel it. And this is a normal finding. So next, we're going to be testing the Blumberg sign. So I'm going to take my hand at a 90-degree angle, and I'm going to go down, and I'm going to apply pressure right at the umbilicus. If she feels any tenderness or pain on the rebound, that'd be a positive Blumberg sign. You feel any pain?
No.
Or tenderness? No? Any pain or tenderness?
No.
So it's a negative sign. Okay. Go ahead and move your body over to the, yep. Very good. And next we're going to be inspecting the lower extremities. And I'm just going to readjust the angle of the angle of the camera so you can see me. Okay. All right. Angle it one more time. So I'm inspecting your lower extremities for any skin lesions, nodules, or any edema, and I do not know any. Next, we're going to be testing the range of motion of the hip. So I'm just going to flex the hip. I'm going to come out, and then this is going to be abduction, and then crossing into the midline, adduction, and then, yep, flexing there, and then we're going to go internal rotation, external rotation, and for the purposes of this exam, we will not be testing extension. Next, we're going to be moving over, and she has good range of motion at the hip. Next, we're going to be moving over to the knee, testing range of motion of the knee. So this is going to be flexion and extension. She has good range of motion of the knee. Next, we're going to be moving over to the ankles, testing range of motion of the ankles. So we're going to go dorsiflexion, plantar flexion, and rotation. She has good range of motion at the ankles. Next, we're going to be moving over to testing the strength of her knees. So go ahead and flex your knees. I'm going to put my hands right here, and then she's going to push against resistance. There you go, and push against you. Very good. She has 5 out of 5, or she has great strength bilaterally, 5 out of 5. Next, we're going to be testing the strengths of the ankles. So go ahead and apply dorsiflexion with resistance toward you. Now plantar with resistance toward me. And then she has 5 out of 5 strengths bilaterally, good strengths bilaterally, and good range of motion. And then next I'm going to be feeling for the dorsalis pedis pulse. It is 2+ bilaterally, so she has good pulses intact there. Next we're going to be testing the spine, so we're going to conduct the spine exam. Abby, I want you to go ahead and stand right here for me. Face away from me. And I'm going to be feeling along, palpating along your spine for any abnormal contours, symmetry, or tenderness. So I'm coming down her spine. Okay. I do not feel any tenderness. Okay. Next, I'm going to be testing her range of motion of the spine. So I want you to go ahead and bend go ahead and touch your toes. So bend at the spine or the waist. Go ahead, stand up. Go ahead, bend backwards. That would be extension. Now go ahead and perform lateral flexion to your left. Very good. And lateral flexion to your right. Very good. And then go ahead and perform rotation to your left and rotation to your right. Very good. Next, we're going to be performing a Romberg test. So go ahead and stand toward the edge of the, And I want you to go ahead and close your eyes, keep your hands at your side, and she'd be closing her eyes for up to 20 seconds. And I'm looking for any swaying, and I do not see any. Go ahead and open your eyes. That would be a negative Romberg test. So now we're going to perform I'm going to be assessing her gait. So go ahead and take a few steps towards me. Very good, and take a few steps back. Very good. Her gait appears to be intact, and this concludes my assessment.